The globe is dealing with a major medical issue. There are just not enough doctors to manage the expanding number of patients. Artificial intelligence might be the cure. AI has the potential to revolutionize how patients are diagnosed and treated, as well as speed up and improve the testing of novel medical techniques. Welcome to another tech-related video. In today's video, we will talk about how AI can make our healthcare better. Elaine Manor is deafeningly blind. She has age-related macular degeneration in one eye, the most frequent cause of blindness in the United Kingdom and the United States. She was scared when it moved to her other eye. She was shattered, sobbing in the rain and thinking she didn't want to be there. The prospect of losing her other sight loomed big for years till a successful treatment allowed the grateful 75-year-old to go see her path to some high-wire fundraising. She crossed the high sick line in Europe, followed by a skydive and a wing walk. Elaine is one of the fortunate people, according to the doctor who spared her eyes. Nearly 10% of all NHS clinic appointments are for eyes, amounting to nearly 10 million appointments every year. To put it bluntly, the volume of patients is nearly overwhelming. They require vision, and as a result, some patients are rendered blind as an outcome of delays in receiving treatment. A pregnant mother was left nearly blind while waiting for help. She has not seen her daughter's face since giving birth. Artificial intelligence, according to Dr. Keane, is the answer. He and his collaborators have created an artificial intelligence, or AI, that can diagnose over 50 different types of eye disease much like a doctor, but considerably faster. The AI system could examine retinal scans in moments and identify all of the numerous disease characteristics that are shown on the scans. The identical task could take human specialists hours or even days to complete. In 2020, AI can assist in addressing a major global concern. Worldwide, an approximated 596 million people suffer from distant vision impairment, with 43 million of them blind. Both of these percentages are expected to rise by roughly 50% by 2050. Artificial intelligence has reduced a task that used to take professional doctors hours to seconds, and it isn't just vision. Because AI can harvest and analyze patient records significantly more rapidly than humans, diagnosis in several areas of medicine should enhance. In the hospital, doctors perform over 1,000 examinations per day. This is a challenge because where will they find the medical doctors to examine all those scans? But it's an advantage since that massive volume of data is the ideal substrate for artificial intelligence advancement. However, there are some uncertainties. DeepMind, Google's AI company, and one of Dr. Keane's colleagues have come under scrutiny for concerns about patient confidentiality. Google DeepMind, the company's artificial intelligence department, may have illegally obtained the individually revealing medical records of 1.6 million NHS patients at the Royal Fair Hospital. DeepMind is facing serious legal proceedings over its usage of NHS data, which is unrelated to its work with Dr. Keane. However, if data security is improved, AI has the potential to significantly improve and streamline healthcare. So while the doctors work in an essentially connected world, healthcare data remains segregated. They can book a cab from practically anywhere in the globe using their iPhones, but they frequently can't link their data when they have one patient who visits Moorfields Eye Hospital but then goes to another hospital because they have cancer. Dr. Keane thinks that his current cooperation with Bitfund, a machine learning firm, will not only increase data connectivity but also patient privacy. Bitfund functions as a switchboard. All we do is transfer communications between somebody who wishes to ask a question about the collected data and the data owner. Because data don't ever leave its original place, no data from a hospital ever leaves a hospital. According to Bitfund, this technique might offer further advantages, such as approving innovative therapies more rapidly and safely. Patients are losing a lot of money since their preferred medical treatments aren't available. To market with the additional technological guarantees, doctors use privacy-preserving solutions such as Bitfund can give. There's a clear sense in the healthcare ecosystem that some of those governance procedures should be sped up. The value of AI in the healthcare business is predicted to just be 8 times higher by 2027 than it was in 2020, Clinicians might enhance growth by reducing their reliance on coders and developing their new AI systems. This is particularly intriguing because retinal scientists have been unable to determine gender. Dr. Kira Oborn is one of a group of physicians who have developed AI that can determine gender from retinal scans, similar to what Google Brain performed in 2018, something that no human being is capable of. A participant of their research team created a deep learning approach that successfully detected gender from reasonable photos without using any code. This is really interesting because it gives physicians the ability to construct their own programs individually, which might lead to more discoveries and patterns of disease and biomarkers. A new breed of doctors believe that giving clinicians more control would help them get closer to their patients. In most cases, the clinician is the healthcare worker who interacts directly with the patient to determine what they require. As a result, I feel that allowing them to design their own tools on their own will permit the patient to stay on top of everything. This is the first battery-powered handheld computer capable of storing massive amounts of data. Doctors believe we are approaching a tipping point similar to the one seen in the 1970s. The development of the first desktop computers occurred in the computing industry. People are coming up with hundreds, if not thousands, of possibilities if they are given this technology, even if it is crude at first. However, some are wary about placing too much faith in artificial intelligence. The problem is that AI systems are essentially black boxes, which means that when they operate effectively, no questions are raised. But what if you make a bad decision? Whenever something bad happens, what takes place? And if doctors are utilizing black box models, how could we really trace it back and ensure accountability and interpretability? While AI in medicine is still in its infancy, it has the capacity to boost the testing of innovative medical devices. Everything used to be completely free a million years ago. Patricia Walker, a former part-time singer and model, had a synthetic valve implanted in her heart that saved her life in 2021. Although Patricia's procedure was successful, it was not without danger. The cardiologist who implanted the valve believes that using AI to create simulated trials can make breakthrough technology like this safer for patients. If doctors can prepare an operation by modeling it in a computer-generated simulation for an individual patient, they can achieve a far better result for the patient without putting the patient in danger. Dr. Blackman is working with Professor Alex Frangi in the University of Leeds. He's automating the creation of three-dimensional digital reproductions with machine learning. Multiple versions of a newly proposed treatment or technology can be tested via virtual experiments. Doctors may test multiple therapy scenarios on the same anatomy and physiology of the virtual human, which is something that can't be done in traditional trials. They're also comparing hypertension and normotensive conditions in different circumstances. Virtual trials don't really replace human trials, but they do shorten the time and expense of identifying the suitable technologies and people to test. In 2021, a team from the University of Leeds discovered that their virtual trials generated the same outcomes as 3 clinical trials, but considerably more quickly. A piece of those studies took about 6 and 8 years to complete and were priced between $20 and $30 million each. So what they proved is that the computer research took about 3 months to complete, which is less than $20,000. Some medical professionals feel that as AI becomes more complex and powerful, it will have a bright future. To put it in another way, smarter. AI 1.0 refers to the capacity to automate processes that would otherwise be tedious, time-consuming, or repetitive. AI 2.0 is the version of AI that aims to incorporate past knowledge of physics and physiology into the data in a far more intimate way. As a result, it is not just data-driven but also knowledge-driven. It's difficult to imagine a future in healthcare without AI. Many people believe that artificial intelligence will one day rejuvenate our vision. Quit being sluggish because it's time to put your intellect to work. Welcome to Technology Zone, where you'll find fascinating information from past, present, and the future, from the grandeur of nature to wild creatures and amazing truths. Subscribe today and you will never be disappointed.